Good afternoon, and thank you for joining us for this community briefing on COVID-19 and our local response efforts. Joining me once again is interpreter Francis Beauvirage. Thank you, Francis, and congratulations on being the newest admiral in the great Navy of the state of Nebraska. It was very fun to read about you in today's paper, and I have a spare copy for you. Thank you also to the media and to all the residents who are tuning into these briefings. You can continue to find additional information about how to protect yourself, your loved ones, and our community at our website, covid19.lincoln.ne.gov. Moving on to our situation report, we've had 3 new cases of individuals diagnosed with COVID-19 in Lincoln today. The total number of people in Lincoln with lab-confirmed cases of COVID-19 is now 62. One of the cases is still under investigation, but 2 have been deemed community acquired. So the total number of community acquired cases now stands at 43. Here to provide more details on the health department's investigations of these cases is Interim Health Director Pat Lopez.
Good afternoon. The community acquired cases are a woman in her 30s and a woman in her 50s. The third case is still under investigation and is an individual also in their 30s. All are self-isolating and close contacts are self-quarantined. 4 Lancaster County residents are hospitalized at this time, and 1 is currently on a ventilator. Nebraska now has 987 cases of COVID positive individuals, and we've experienced 21 deaths. One of those deaths was in Lincoln last week. With the additional cases today, Lancaster County is at about 3.2% positivity rate. That's the number of positive cases compared to the total number of tests completed. The state remains at about 8%, and the national rate remains at about 16%. I really want to thank the public for continuing to follow the directive health measures we have in place. We all must continue to take the necessary steps to protect ourselves and others. Stay home, practice physical distancing, wear cloth face coverings in public, and self-isolate and self-quarantine when necessary. These practices are really making a difference for us here in our community, and we need to ensure we don't get complacent. This COVID-19 virus is a lingering disease. Unlike flu, which comes on quickly and lasts about a week or 10 days, this disease seems to slowly take over hold over a longer period of time, and the recovery is a bit longer. This is why we have concerns of overwhelming intensive care capacity in our hospitals. As we have said, trying to flatten the curve so too many people were not sick and needing care at one time is why we have put the measures in place. Our community has worked together in great partnership. From public health, healthcare, first responders, businesses, schools, child cares, and I could go on and list others. We have all made a tremendous difference. Lincoln residents are doing their part. Physical distancing is the major way the public has taken responsibility alongside government, public health, and healthcare networks responding to this pandemic. We still want to emphasize for everyone to continue physical distancing, and this includes keeping your interactions to those within your own household as much as possible. Let's all follow the governor's message of staying home, staying healthy. We all need to keep active and stay mentally fresh. Let's also stay connected virtually with our family, friends, and neighbors.
Thank you, Director Lopez. We continue to, again, urge all those who have symptoms of COVID-19 to access the drive-through testing that are available through Bryan Health and CHI Health St. Elizabeth. Because of the snow, CHI Health will be doing that testing at their hospital site today. But Bryan Health's drive-through testing is operating as usual at their LifePoint location at 27th and Pine Lake. The drive-through testing sites have increased capacity, and that's good news. They can test 150 people a day. And we did see a small increase in testing yesterday. 74 tests were done as compared to 63 the day before. But those 74 tests were really just half the capacity that we have available. So we want to, again, reiterate that the drive-through testing is easy and safe. And just to begin the process, you need to fill out a simple online questionnaire at chihealth.com or bryanhealth.com. And if testing is recommended, individuals will be given an order and referred to one of the drive-through testing sites. The drive-through testing sites will accept those who have received orders and referrals from Bryan Health or CHI Health St. Elizabeth. It'll also accept those who have an order from their doctor. And if you need help accessing a healthcare order from a provider, you can call our health department and they can assist you. And that number to call is 402-441-8006. As Director Lopez said, this is not a time to let down our guard. Stay home as much as possible, except for essential errands. Stay at least 6 feet away from others and wear a face covering anytime you're out in public. One of the reasons you might find yourself out in public right now is one of those essential errands that every family must continue to do, and that is shopping for groceries. Today we'd like to discuss how to navigate retail environments when you must go out into the community, whether that's grocery shopping or picking up medicine, having a vehicle repaired, or any other essential reasons why you might have to leave home. It's really important that both you and the businesses that you visit practice physical distancing and take other precautionary steps to prevent the spread of COVID-19. So today, we plan to highlight some of those best practices and precautionary steps that both customers and our retailers can take to protect the public and retail employees during this pandemic. And to all of those retail employees who are dutifully going to work while many of us stay home, and they're making it possible for us to continue to get our bread and milk or pick up medicine or to stock up on soap and sanitizer, thank you. Thank you so much for your faithful efforts that are helping to take care of the welfare and well-being of our community. We really appreciate you, and we want you to know how much it means that you're showing up at your workplaces to take care of the rest of us. At this time, I want to invite up to the podium Councilwoman Jane Raybould to join us for some insights. In addition to her position as chair of the City Council, Councilwoman Raybould has years of experience in retail and is an executive at B&R Stores, which operates both Super Saver and Russ's Market here in Lincoln. Councilwoman Raybould, thank you so much for joining us today.
Good afternoon, everyone. There, I'm all sanitized. Thank you so much, Mayor. And I can tell you that these are really challenging times for grocery operators. We are incredibly busy. And as a local independent retailer, and on behalf of all the retailers, I can say we are doing everything we possibly can to keep our associates and our customers safe. First of all, I want to give a big thank you to those essential grocery workers in our city, like the mayor said, and in our state for braving so many uncertainties and showing up to work, working long hours, and serving those in our community. As we know, it's up to each and every one of us to do our part, however big, however small, in keeping each other safer. And I want to send a special thank you to the Nebraska Grocery Industry Association for sharing many of these recommended best practices with our member grocers throughout the state. So here are some of the ways we can protect one another as people access essential services. You've heard this so many times from Pat Lopez and our mayor. Stay home. Stay home if you are not feeling well. You have a fever, a cough, or shortness of breath. Please send only one person, your designated Brave family member, to do the shopping and bring a shopping list so that they can stay focused. If possible, and it naturally pains me as a grocer to say this, but please try to limit your shopping to once a week. So for our seniors or those that are immune compromised individuals, the secret is the best shopping times to go out and get your shopping done are between 9 a.m. and 11 a.m. or at late at night. You have many shopping options nowadays, like Instacart that delivers directly to your home or drive-up pickups. Choose the method that is the best for your family and your family's shopping needs. Wear a face covering. How many times must we say this? But it can be homemade or otherwise. If you have gloves or disposable gloves, then wear those too to do your errands. This is for the protection of those amazing people that are serving you in your local store. Remember and do your part to physically distance yourself from fellow grocery shoppers. Read the reminders in the store. There are many. Follow the shopping directions for those that use one-way shopping plans. Some stores even restrict the number of shoppers inside to further protect the public. Bring your own personal small bottle of hand sanitizer with you on each of your trips. Many of your retailers have those grocery cart wipes as you enter the store. Please use them to wipe off the handlebar area and other areas you are likely to touch while shopping. And honestly, try to just use one of them per grocery cart because those too are somewhat limited. Practice looking but only touching the items that you are going to be purchasing, especially in the produce area. And I know that's very difficult for many of us that want to individually touch that piece of fruit, but please try to just use your eyes only and then select. As you get ready to go to the checkout and pay for your items, practice physical distancing and pay for your items if possible with a credit or debit card to further limit any physical contact. And as you have noticed, many, if not all, retailers have added plexiglass partitions to protect the cashiers and clerks and serve as another reminder to keep your distance. Use your hand sanitizer as you load your car and drive home. And when you get home, be sure to wash your hands. That is so fundamental. Wash your hands. Wash all the produce. Use cleansing wipes to sanitize your purchases as added safeguards to keep your family safe. And so, here is what we are doing as retailers to keep our wonderful customers safer. We are requiring our associates to stay home if they do not feel well and have a fever or a cough. We, like many retailers, are waiting for our infrared thermometers to deliver so we can make sure everyone is healthy when they report to duty. We are stepping up our routine procedures of hand washing and sanitation in all departments. We are using gloves and masks and hand sanitizers for all processes. And we are using every other register when people check out to promote safe and safer distancing. We're making sure our associates are rested by reducing our hours of operation that we are open to the public and making sure that our associates are well nourished by providing a free meal on every shift. This, in turn, gives our evening crews more time to replenish the shelves and restock, and most importantly, sanitize the store for the next day's business. And you're seeing at many stores, they're asking no backpacks, no reusable containers, no reusable bags are allowed in the stores. And we ask that nobody return product because at this time we just do not know where that product has been. And lastly, Just a huge thank you again to our loyal customers for their patience and the many, many kindnesses they have shown our associates. We are all in this together, so thank you. Thank you, Mayor, very much for all you're doing.
Thank you, Councilwoman. Thank you what you're doing to help keep our residents safe when they must go out for groceries. Moving on, we want to share with you some updates on some of our city services and operations. As if we didn't need another reason to stay home, today Mother Nature apparently forgot that it is now spring. And Lincoln is in a winter storm warning until 7 a.m. tomorrow. Lincoln Transportation Utilities has 20 crews out spreading granular salt pre-wet with brine. And right now the main streets are wet, but the temperature is falling, so drivers, we all just need to be really careful out there and watch for slick spots. LTU Director Liz Elliott is here with more information on what should be spring, but are in fact still winter operations. Liz?
Thank you, Mayor. As Mayor indicated, there are currently 20 trucks out applying the de-icing treatments to the 1,012 miles of arterial streets. Once the arterials are completed, we will then focus on the bus routes. With our current fleet capacity, it should take us about 5 to 6 hours to complete a full treatment. These de-icing trucks are the backbone of our winter operations. Unlike snowplows, the de-icing trucks are used in every single winter operations that we do. And based on the current information, we are not anticipating the need for a full-scale plowing operation due to favorable ground and ambient temperatures. Therefore, our primary response will be the de-icing treatments. However, we are actively monitoring the pavement temperatures as well as short and long-range forecasts and the conditions provided by our weather service consultants. If the need for plowing begins to change, we will deploy our snow plows as well as reach out to contractors that assist us with our snow plowing needs. We will also be treating the bridge structures as the temperatures drop this evening. The snow event is very dynamic, so we will continue to actively monitor the situation and will adjust our plans and operations as the situation requires. Our staff will continue to work through the night to ensure that the roads remain safe for the citizens of Lincoln. Thank you.
Thank you, Director Elliott. And again, we just want to remind everyone to be careful. If you're driving around town, please give our crews lots of room to do their job. As our winter operations manager, Tim Byrne, typically puts it, respect the plow, or in this case, respect the de-icer. Next, we have an update for you on some additional safety precautions we are taking in our parks. Public playgrounds, of course, have been closed for more than a week now, and that's because playgrounds are high-touch surfaces on which the coronavirus may be able to reside for a number of hours. And we don't have the ability to ensure that those playground equipment pieces can be disinfected before each little set of tiny hands is on them. So we are today at Parks and Rec taking further steps to protect our youngest residents. Parks and Rec is removing swings from frames and wrapping play structures and fitness equipment with construction fencing. And that's to further limit access to these pieces of equipment, to limit access by those who may not understand or recognize that these are in fact closed. The fencing started with playgrounds in larger parks, and the department anticipates that this work should be complete by the end of day tomorrow. And now for some good news that we want to share. We are innovating, like many, through this pandemic, and the health department has started a decontamination process for our personal protective equipment, or PPE, using ultraviolet light. These are procedures that were first experimented with at UNMC, and we are following their equipment and testing protocols and implementing a similar process right here in Lincoln. This system will disinfect N95 masks for use by first responders, law enforcement, healthcare providers, and nursing home staff in an 18-county area called the Southeast Healthcare Coalition. And we are so pleased to be able to provide that service. And this is just one example of how each day our public health system's capacity is growing stronger to protect you and your family. And last but not least, the Lincoln Strong Online Music Festival continues tonight and every Thursday through May. Again, thanks to musician Jack Rodenberg for organizing this fun showcase for our great local music scene. You can catch Jack playing at 7 p.m. tonight with the Wildwoods. And before that, at 6 p.m., you can hear Ro Hempel. So check out the Lincoln Strong event page on Facebook, where you can tune in, and it just seems like it's a pretty good night to have an indoor dance party, maybe even with some hot cocoa. With that, we will open up this briefing to questions from the media.
Mayor Mackenzie Huck with 1011. My question could be for you, or it could be for Director Elliott. Forecast models are showing up to 5 or 6 inches of snow for the capital city. Are there any plans to plow residential streets?
I'll let Elliott come on up and answer that question.
Mackenzie, right now our resources don't provide for proactively going to the residential streets. So what we will be doing is looking for conditions worsening in certain areas and trying to tackle those on a priority basis. It is also complaint driven. So if we do get reports from the neighborhood that there's a particular difficult or icy location, please let us know and we will make sure to try and get our resources out to those areas. Thank you.
One of the only good things about reduced traffic right now, from an indication that people are staying at home, is that we expect fewer accidents and fewer people to be trying to navigate our streets. So we've got that going for us, I guess. Mayor, would you mention they can use the uplink? Yes, and if you, to report particularly icy locations on streets or problem areas, you can use our uplink app. That's UPLNK, and we'll get that responded to as quickly as we are able. Other questions from the media? Okay. Well, we very much appreciate you tuning in and helping us get the message out about how to keep people safe and healthy during this challenging time. Thank you so much. We'll see you again tomorrow at 3:30.